Good morning, everyone. My name is Eleonora and my field is anesthesiology. In the last 10 years, I've had numerous conversations with my patients about chronic pain, and my book is a message for fibro patients. Don't give up, try until you find what helps you, and wait for the expert to provide the solution. To not cause you more discomfort than your disease, my presentation will be in Italian with subtitles.
Fibromyalgia is a syndrome characterized by widespread chronic musculoskeletal pain, physical and mental fatigue, sleep disturbances, and fibro-fog, for example, cognitive impairment. To these main symptoms, many others can be added, which vary in terms of the organs affected and in their presentation in different patients and in the same patient over time. Fibromyalgia has been recognized by the WHO as a disease since 1992. But only in 2019, it was classified as a primary chronic pain disorder. Fibromyalgia is currently considered the most common chronic widespread pain disorder worldwide. It is often associated with other pathologies, particularly psychopathologies and rheumatic diseases. The chronic pain of fibromyalgia is defined as nociplastic, meaning it is due to an alteration in the way our brain interprets stimuli. However, fibromyalgia and nociplastic pain are not synonymous, and fibro is not the only syndrome with nociplastic pain. The leading experts in the field believe that the alterations underlying chronic nociplastic pain are not definitive, meaning that it is possible to aim for a cure, especially if diagnosed early. The diagnosis of fibromyalgia is very complex and still relies on clinical features, as specific tests to identify it are lacking. Unfortunately, there is currently no cure, but the treatment plan is aimed at controlling the symptoms and thus improving quality of life. The therapeutic approach must be a biopsychosocial approach, tailored to the individual patient, modified according to the progression of symptoms, and it must include educational activities, physical activity, and cognitive behavioral approaches. Only in cases of very painful symptoms is the use of medications generally advised. Research is ongoing, and we hope it will soon provide more precise answers and increasingly effective treatments. If you would like to keep learning, you can subscribe to the title of the book I wrote, after carefully researching the scientific literature of leading experts.